Illicit drugs and hard drugs should not be used where kids are playing, where patients are recovering, where community life is lived.
Right across Canada, the opioid crisis is getting worse, and in BC, the situation is becoming dire, with nearly 14,000 people having lost their lives since the epidemic was declared in 2016. In January of 2023, a 3-year pilot project to decriminalize 2.5 grams or less of hard street drugs was enacted in BC.
Instead of being treated as criminals, they will be treated with care and compassion. Decriminalizing people who use drugs is a critical step in tackling the toxic drug crisis.
However, just a year later, many would say it's not working.
Since day one, the British Columbia Association of Chiefs of Police has expressed significant concern with the issue of public consumption of illicit drugs. This concern is based on a fundamental belief in the importance of finding a balance between ensuring that people who use drugs are not unnecessarily criminalized, while all members in communities across this province feel safe.
Now, BC wants to amend the decriminalization project to allow police to arrest addicts using hard drugs in public.
But that compassion, that concern for people who are struggling, does not mean that anything goes. We today have made a formal request to Health Canada to amend the exemption to the Controlled Drugs and Substances Act, which will give the police the tools they need to enforce the law anytime someone is using drugs in an inappropriate location and compromising public safety. In short, this amendment will make public drug use illegal in British Columbia.
We have always said that for decriminalization to succeed, it has to be part of a broader strategy to address the tragic consequences of the drug crisis that has killed far too many British Columbians. Treatment, education, prevention, and enforcement against predatory organized crime groups are equally important.
Tina House, APTN National News, Vancouver.